Hi everyone, this is board certified plastic surgeon Sean Doherty from Boston, Massachusetts, and today I wanted to talk to you about the breast augmentation procedure. This is certainly one of my most popular procedures. I see many patients who are interested in this and I perform it quite often. It's also one of my favorite procedures to do. I want to talk about a couple of things that many patients ask me during the consultation process and when they're considering that. And then lastly, I want to kind of talk about pricing, and I know that's on everyone's mind. So what are some of the variables and considerations that you should think about when you're considering a breast augmentation procedure? Firstly, your surgeon. I recommend a board certified plastic surgeon who operates in an accredited facility. And so a board certified plastic surgeon is accredited by the American Board of Plastic Surgery. And he or she would operate only in an accredited and appropriate either outpatient surgical facility or hospital setting. Another variable is the implant itself. Are you interested in a saline implant or a silicone gel implant? Both have high safety factors and are quite appropriate and very useful and safe in patients, but there are variables to each of those that are appropriate for some patients and not for others, and that is up to your surgeon to talk to you about that. Next is the size and shape of the implant, and that certainly is based on your body and what fits you well, and then ultimately what your aesthetic is that you're looking for, so what augmentation you're looking for. Where does it go on your body, above or below your chest muscle, and that's your pectoralis muscle that's here. Some women have a better result when the implant is placed below the chest muscle. It smooths out the implant and perhaps creates a little bit more of a subtle outcome, but also a smoother outcome. And then someone's anatomy really just lends itself to having their implants above the chest muscle, and that is up to the surgeon to talk to you about and assess. And then lastly is the incision. So how do we get in there? How do we place the implant? The two options that I think are on the table are your inframammary incision, which is below the chest, and then around the areola, which is here. I prefer the incision below the breast, so that's the inframammary fold, but again, your surgeon will talk to you about your breast options. So the cost. This is a reality, and I think a lot of patients are quite concerned about that, so let's sort of just talk about it. I operate in Boston, Massachusetts, so this is an urban setting. I think that the cost of procedures and most things are just more in this area than, say, other non-urban areas in the United States. So I think our costs tend to be a little bit on the higher side. The total cost on average for a breast augmentation patient in the Boston area is between $8,000 and $9,500. Now that is the total cost of the procedure. That involves the cost of the implants, my fee, which is called the surgeon's fee, the facility fee, that's the cost of going into the procedure room or the hospital, and then the anesthesia fee. Now, once you're over the price and it becomes a reality, what are some of the things that you're looking for and that you should ask about your surgeon to talk about? One is, who is that surgeon? I told you I wanted you to go to a board certified plastic surgeon, but what's their temperament? What's their personality? What's their aesthetic? Do you get along with them? Do you get along with their staff? Is their office convenient to get to? All those things are important to think about. And I highly recommend that when you're considering a surgical procedure that you visit more than one plastic surgeon. I say looking at their website online, it gives you an idea of kind of who they are, what their aesthetic is, and that's kind of what is important to them visually, and then ultimately seeing them and seeing their office to see where you're comfortable. Then some things that are very important to talk about in your consultations are complications. And so complications can happen with procedures, and I think there are some specific ones with breast augmentation procedure that all patients should understand. Capsular contracture, that is tightening of the capsule, which is the normal tissue that forms around the implant. That can be a devastating result. It can require surgery and can just create not a great aesthetic outcome. The implants these days, so compared to say implants 10 or 15 years ago, have a much lower risk of capsular contracture, so that's less of an issue these days. However, women who have had multiple surgical procedures, women who are smokers, women who have implants that are too large for their chest or their anatomy, and then women who have procedures that are a little bit messy, meaning there is bleeding or infection and some complications with the surgery, are more at risk for capsular contracture. Two other things that one needs to talk about in their time of consultation are breast implant illness and ALCL. Breast implant illness is something I could talk about for an hour, and perhaps we'll speak about it in another video, but it is a constellation of symptoms that has been associated with some implants, and it's very important for you to talk to your surgeon about that, what risk factors you may bring to the table, that it could be a reality that it might be in your future, even though it is quite rare. And then lastly is ALCL, and that is a lymphoma that has been associated with patients with some textured implants, and there are about 500 patients in the world who have had that issue. It is a devastating issue and certainly nothing that we wish upon our patients, as is any of these other complications, but we do need to talk about them. All right, so despite these negative things that I just talked about, the breast augmentation procedure is one of my favorite things to do. My patients are super safe, super happy, and I look forward to chatting with you about the potential procedure. Thanks.